We've been talking about the problems that can result when the blood flow is disrupted to the brain, but that can also happen in other parts of the body, like your limbs, legs, and arms. That's called peripheral artery disease. Now, a look at how it can affect you and the specialized care available. Patty Schmitt was planning a special vacation when something went wrong.
It felt like my hip was going out on my left side. As I walked, I got severe pain, and I would get maybe 3 foot, and I'd have to stop, rest, and it would only be maybe a minute or two, and then I'd take off again and I could do it. But it got very maddening, and it was kind of scary that I didn't know what was going on. I really thought I was going to have a total hip replacement. But you're right, but it was only seemed more in the left leg than it did the right leg, so that was scary also for the left side. But it wasn't.
A screening test showed Patty had peripheral artery disease, or PAD.
Peripheral artery disease is basically an atherosclerotic plaque, or basically a buildup. And the same thing that when people talk about coronary artery disease and heart attack, it's the corollary to in the legs, in the arms, where instead of having a heart attack, you sort of have a leg attack, where you start having cramping. And not only that, it's a little bit more insidious. Instead of just having cramping pain, puts you at risk for losing your leg and having amputations.
Dr. Schmieder is Patty's doctor.
She presented with complaining of that she couldn't walk much. She could walk about a block, maybe 2 at most, before she had to stop. She also was having some pain in her buttocks and hip area. On exam, I could not feel any pulses in her. We check in different places, but at the groin level, I couldn't even feel pulses, and maybe a very thready pulse on the right side. Her study showed that she had approximately about 50% blood flow to her legs. So what we proceeded with next to the angiogram, and it was a very difficult case in that she had an occlusion of her iliac system and about a 90% stenosis on her right side.
It was a difficult case, a serious diagnosis for Patty, who was planning a trip to Washington, D.C. to visit her daughter, which would mean a lot of walking. Her doctors went right to work.
We had to do a couple different ways to get through, and through using wires and catheters and balloons and stents, we were able to open up both systems to about 95%. And she had now a return of palpable pulses in not only in her groin, but also now in her feet. The nice thing about that was she was able, we had to keep her overnight for one night, and she was able to go home the next day, and she covered very nicely. And then the best part was when she came back to see me, I think a month or 2 after, she had planned a trip to go to Washington, D.C. With her, I think her fiance at the time. And she hadn't been able to walk much, and so they were concerned they were going to try to walk the mall and see all the different museums. And she was so excited to see me that she was able to tell me that she could walk, she didn't have to stop at all, and she could just walk all the way through, and so that was a nice result.
And I knew I wasn't going to make it very far. We did go to Washington, D.C. and had a wonderful time, and we even talked about it and said, if you hadn't had that surgery, you wouldn't have enjoyed the trip. You couldn't have walked like we did. We must have walked from the Capitol to the White House and back again, you know. And it was a lot of distance, and it was amazing. It was just amazing.
And now Patty enjoys going for a walk, grateful that she's pain-free.